Hi, it's Brain Bites with Dr. B. Today I'm going to talk to you about ADHD. ADHD has been really popular recently, and loosely the symptoms apply to a lot of people. So I'm going to go through some of the things that make people think that they might have ADHD. They start things, but they can't finish. They're doing a bunch of different things at once and they can't focus. Procrastinating about starting stuff. Having trouble remembering what you're supposed to be doing. Frequently making bad decisions. Or being hyper and all over the place. So the DSM-5 gives us very specific criteria that are really clear, and there are time frames that are presented there to really make this very specific diagnosis. Most of you are probably already familiar with these criteria, but here's a quick rundown of what they are as listed in the DSM. To meet the criteria, you have to have at least 6 of the following. So you make careless mistakes, can't sustain attention, you don't seem to be listening when spoken to, don't follow through or you get sidetracked, can't organize tasks, avoid things requiring a lot of sustained attention, losing things that are needed for tasks, getting easily distracted, or being forgetful. There are also some criteria for hyperactivity and impulsivity. This is something we don't see quite as much in adults as we do with children, but sometimes this is when people can't seem to wait for their turn, so they're interrupting others or they're cutting in line, or they can't sit still during a long meeting. The 2 biggest things that I think matter for diagnosing ADHD in adults is the fact that these symptoms, you have to have met the criteria before you're 12 years old. So even though if this person did not have a diagnosis of ADHD, they have to be able to say that they met the criteria. These things were going on. I struggled in these ways. And it has to be in at least 2 different domains. So we're talking about 2 areas of life. So whether it's academic, social, occupational, these are all different areas that you have to have some sort of problem in at least 2 of them to meet the ADHD diagnosis. So for example, somebody who is a grad student, never had trouble when they were younger, and now suddenly they're really struggling to finish their PhD. Maybe it's ADHD, but maybe it's just that it's hard and it's taking a lot of extra planning and a lot of extra care because there's so much going on and there's so much more to do. Same thing with a new mom with little kids, has so much more to balance. There's a lot of different things going on, feels distractible, poor concentration, can't follow through with things. Maybe it's ADHD. Maybe there's some other things going on. Maybe it's depression or anxiety. So there's a lot of overlap with other disorders as well. So a lot of times when people are looking for this diagnosis, they will go see someone specifically for an ADHD diagnosis and they will be assessed for that. They'll fill out rating scales. If you have children that are being assessed for ADHD, often the rating scales will go to a teacher as well. So a teacher will observe, they will see the psychologist for the testing, they will have you fill out a survey to see what's going on. If the child is older, they may have the child fill out the rating scale. So these are just some other ways to get the information for the testing for a diagnosis. But you can make a diagnosis if your client meets the criteria. So then another thing to think about is what I just mentioned with the other diagnoses. So some of the symptoms that we see with ADHD, like poor concentration, trouble starting things, follow through with multiple different tasks, doing a lot of things at the same time, having racing thoughts, can't slow down, feel like you're run by a motor. Some of these things may actually be symptoms that belong to other diagnoses. For example, depression or anxiety. People who are bipolar in a hypomanic or manic state may have a lot of these symptoms, and sometimes substance use as well. So it's important to think about all of these things, because just because someone says, I can't concentrate, I can't finish things, I keep losing my keys, there might be other stuff going on. And that's always what I'm trying to look at. The other place you see a lot of overlap is with learning disabilities and also autism spectrum disorder. So these are all neurodevelopmental disorders. They're all neurodivergent brains. These are all things that we think you're born this way. You have a neuroatypical brain. So these are things that have been going on since childhood. And they are things that we often have to continue to address. So about 10% of kids usually meet the criteria for ADHD, and then about 4% of those adults still continue to meet the criteria. Now, there are some statistics that say that those numbers should be much higher than they are, but those are the most recent statistics that I saw that are accepted. So there may be other stuff out there for that. Another important thing, these are highly heritable disorders, so the neurodevelopmental disorders as a whole, but specifically ADHD, it runs in families. Lots of people, will have parents or grandparents or both that have problems with ADHD, and then it gets passed down. So earlier I gave some examples of people that probably didn't have ADHD because they only have, one area of problems, or the problems aren't that bad. I would like to point out that there are plenty of adults out there that really do struggle with ADHD, and it has a profound effect on their ability to function well, to be successful in work, to feel good about themselves, or to have strong relationships. So if people are really struggling with the different criteria, there can be skills or medication that are very helpful to help these patients become more functional in their lives. So let's talk a little bit about the brain and where these issues are. So just like with most diagnoses, we don't know exactly what it is or where it is that we're having these problems, but there are a few places in the brain that are implicated. So the first, and the one we probably know the most about, is the prefrontal cortex. So that's the area for the executive functioning. So the planning, the organizing, some of the delay in gratification, memory, attention. So that's a lot of that for the PFC, the prefrontal cortex. And then the basal ganglia and the striatum are also implicated as areas that play a big part in ADHD. They're involved in the reward pathways and processing, habits, and motor control. And then the cerebellum is also part of this. It's generally with the motor control and coordination, and a little bit of cognition as well. So those are the areas of the brain. So the neurotransmitters that we think are usually involved in this are dopamine and norepinephrine. So those are the two main neurotransmitters that we're looking at. So with the dopamine, it usually is that the dopamine level is too low, or there's something wrong with the receptors so that you can't uptake the dopamine that's there. So dopamine is implicated in reward, motivation, and executive functioning. And then the norepinephrine is generally associated with attention. One of the theories that we talk about in ADHD is a sensory hypersensitivity or overload theory. So this is the idea where a patient is unable to filter out all the sensory input that they're getting, which makes it difficult to figure out what's important, what's not important, being able to focus because there's so much else going on that's distracting, and they're very reactive sometimes to the sensory input that they're getting. So identifying a priority can be really difficult. So one of the ways that I was taught that this can be imagined is if you think about trees in a forest, all the trees are different heights. Your tall tree is more important and your small tree is less important. And so your job is to go through and take care of all the tall trees and do all the things that need to be done there first. And then you can move down to the smaller and smaller trees. In an ADHD brain, the trees are generally all the same height. So it's hard to tell the difference between a tree that's like, I have a paper to write, it's due tomorrow, or, I have to pick up the socks off the floor. So all of these things are the same height. This helps explain for some people why they just don't seem to get the importance of this task needs to be done now, and this task can wait. In their brain, a lot of these signals, they're all the same height. So it's hard to get that information that says, no, this is the priority. We're doing this right now. The other stuff can wait. So treatment with medications. The gold standard for treating ADHD is with stimulant medications. So there are two types of stimulant medications. There are the stimulants that are methylphenidate based, so that's like Ritalin or Concerta, and then there's the amphetamine based medications like Adderall and Vyvanse. In general, these medications are going to be targeting dopamine to increase the levels, and also the norepinephrine to improve attention, hyperactivity, to help with focus and behavioral management. There are also non-stimulants that are used for people that either can't tolerate the stimulants or can't get the stimulants for other reasons. Generally, these target norepi, but they can also target other neurotransmitters like dopamine. And examples of these would be Strattera, guanfacine, and clonidine. Those are the most common non-stimulant ADHD medications. So the effects that we're looking for with medications, we want sustained attention. We want people to be able to focus on tasks for a longer period of time. We want to decrease the hyperactivity and impulsivity to help with better self-control. We want to improve planning, organizing, and executive functioning overall. And then for a lot of people, we want to maintain emotional regulation. So some people become very dysregulated without these medications to help keep the levels balanced. And then common side effects from these medications. So a lot of times with the stimulants, especially adult patients are at risk of increased heart rate or blood pressure. Sometimes people may feel more irritable or aggravated. In patients with anxiety, it can make their anxiety feel much worse. It can worsen OCD symptoms. It can also affect sleep, leading to insomnia and also decreased appetite. There are also some off-label medications that can be helpful for some ADHD symptoms. So before I mentioned that there's a lot of overlap. So whether or not these medications are really helping with the depression or the anxiety, and that's why it's helping with the symptoms that look like ADHD symptoms, or whether it's still really addressing the ADHD that these patients are taking the other medications for. Wellbutrin, bupropion is one really common medication that's helpful for ADHD symptoms. That's a non-stimulant, non-ADHD medication. And Effexor or venlafaxine. That medication also can help some people with ADHD symptoms. So not everyone who has trouble concentrating has ADHD, but they might. So ADHD brains are different. Neurotypical answers won't always work well here. And just like always, everything requires an individual approach. Hopefully this little brain bite on ADHD and how it can be diagnosed and treated, what causes the problems in the first place, has been helpful. Enjoy.